Hello, everyone. Welcome to this presentation. Our guest today is Nunya Tochiaganya, who will speak on a very important topic, the use of communication as a vital tool for trust development in healthcare. Thank you for joining us today, Nunya. Over to you now.
Thank you, Yaba. Hello, everyone. My name is Nonya Tochiaganya, and I want to thank you for tuning in today to listen to this presentation on a very important topic. Today, I'm going to speak on the fears and the anxieties in healthcare settings and its impact on care delivery practices. More importantly, how we as healthcare providers can begin to use the soft skills of communication, so many styles of communication, to not only help promote a trusting clinical environment, but also to help establish a more productive consultation between the healthcare practitioners and the families, and also the patients. And at this point of the presentation, I'm going to share my PowerPoint for the rest of the presentation. To get it to be a little bigger. Okay, I think. So my name again is Nonya Tochiaganya, and I'm a family nurse practitioner. And I've conducted extensive reviews of research studies in the impact of fear and the effect of compassion on care delivery practices. And for close to 30 years, I've maintained contact with diverse patient populations. Initially as a nurse's assistant for 9 months, that was one of my very early jobs when I first migrated from Nigeria, because I'm originally from Nigeria. Back then, I worked as a nurse's assistant in a subacute facility in Brooklyn, New York. But I then went on to become a registered nurse and a family nurse practitioner, a role that I've practiced in now for more than 19 years. And I currently work at this point at a retail clinic setting. But prior to that, I co-owned a private medical clinic in New Jersey. And in 2019, I published an online course, Communication Academy, with courses that have received accreditation to grant continuing medical education to healthcare practitioners. I've also published 2 books on the effective use of communication techniques for establishing trust within and outside of the healthcare setting. I'm also a fellow of the American College of Healthcare Trustees. Educational objectives of this webinar include improving the ease for participants to interact with patients of diverse attitudes and attributes to promote a trusting environment. And also another goal of this presentation is to provide information that will help us as healthcare practitioners assist patients to feel comfortable, especially when patients' attitudes a manifestation of underlying anxieties. It will also help provide participants with the strategic interaction skills that can be implemented towards establishing a trusting environment while reducing patients' fears about the healthcare system. And in the course of my research, I've discovered that many healthcare establishments either have existing programs or have initiated new programs that have to help address patient and staff anxieties. And we all can attest to this fact that during this period of a worldwide pandemic, it has created undoubtedly a lot of fears and also continues to create more fears and anxieties for patients and families and staff in the general population and also in various clinical settings. For patients in particular, sometimes these underlying anxieties can manifest as various attitudes that make care delivery even more challenging in an already stressful environment. Some healthcare establishments have established programs with mental health initiatives for tackling overwhelming emotions that could lead to unmanageable anxieties for patients. There are various Get to Know Me initiatives that assist patients and families to improve the comfort of the hospital and clinical experiences, such as the use of the mask with smiling emojis, and sometimes you can have healthcare practitioners that have identification badges that have very cheerful pictures on them. And sometimes you also have these emojis that have very cheerful emblems on the mask. And these are all initiatives that healthcare establishments have instituted just to help to create a welcoming environment, because we all know that wearing the mask hides our smile, and it makes it hard to create a welcoming environment when our smiles are hidden behind the mask. And other excellent initiatives include programs in some institutions that offer anonymous proactive mental health and suicide risk screening to healthcare providers. At-risk providers are referred to programs that address the mental health, lifestyle behaviors, and job satisfaction of healthcare practitioners. In the course of my study research, while reviewing these existing empirical studies by other researchers and scholars, I realized that some study reports by physicians, psychologists, and philosophers highlight such factors as dwindling human compassion as contributory factors for the decline of trust in healthcare delivery practices. Additional discoveries include the implementation of various methodologies by healthcare establishments for more efficient care delivery, such as the use of the Wong-Baker Pain Scale for pain assessment and management. But I never quite came across any studies that explored the universal methodologies for addressing patient fears and anxieties within the healthcare settings through strategic interaction patterns. And this could just be because fear and the perception of fear is a complex issue with various factors and perspectives playing key roles in the interpretation of fear in the healthcare setting. The key to establishing a more trusting environment, regardless of what attitude a patient displays upon presentation, is to first identify patient characteristics that could possibly signify underlying anxieties, and then engage strategically to help alleviate such anxieties while promoting a more trusting clinical environment. So in my 30 years of providing healthcare services to patients in various settings, earlier on as a registered nurse and currently as a family nurse practitioner, I've had the honor to care for patients of diverse backgrounds, characteristics, and attributes in settings such as home care, acute care, subacute care, private clinic, long-term, and currently in the retail clinic setting. And I've realized that many of the behaviors that patients present with are due to underlying anxieties. Sometimes patients present as suspicious, angry, overwhelmed, opinionated. Sometimes patients are dependent, they're skeptical, impatient, sometimes even talkative, all due to underlying anxieties. Okay, at this point, let's discuss a particular characteristics and its impact on healthcare delivery and how the healthcare practitioner can effectively interact with patients who display such emotions in healthcare settings. And I'm referring to the emotion of anger. In my 30 years of interacting with patients, I've noted that patients who display anger really have no reservations about voicing their true opinions. And I look at it this way. These patients who are angry are typically in their true state of mind, what I call their true selves. So clinicians could utilize this valuable moment because in this state of mind, when someone is in touch with their true self, that person is typically vocalizing their feelings. And I actually view it as an appropriate moment of vulnerability, and providers can strategically tap into that moment to establish a more trusting conversation with the individual. And there are various ways to achieve this. First, healthcare providers should listen more than they speak when they encounter a patient who is angry. And after listening, I've realized a pattern of response that has truly helped me so many years to form some sort of tranquility when interacting with someone who is angry. I will say something like this: correct me if I'm wrong, but I heard you say, and then I will fill in the rest of the sentence with my own view of what I thought I heard the person say. What this pattern of statement achieves is that it really helps to validate to the person who is angry that you, as the healthcare practitioner, was listening. And by further engaging with the person, you'll find out if there's any misconceptions that you may have been revealed, so that both of you can now discuss that as a dialogue in a more gentle way to come up with different strategies to help address the current issue at hand. There are patterns to avoid to help promote a trusting environment while interacting with a patient who is angry. A few things that clinicians should avoid doing is not to get angry themselves. And also, don't be confrontational or condescending. And please don't pretend that you didn't hear the patient, because these patterns would only infuriate the patient even more, as it could appear that you weren't even listening to the patient's concerns. And this will only lead to further communication breakdown. I must point out at this point of the presentation that all scenarios do not always fit into the one that I just described. In some unique scenarios, patients may present in an aggressive manner towards the healthcare practitioner, and there are usually effective response protocols specific to those scenarios for various establishments, healthcare establishments. Say, for example, if the healthcare practitioner is in a setting where there is an emergency call button, or sometimes it could be settings where patients are housed in psychiatric facilities, and sometimes patients can be quite aggressive in some of these facilities, the practitioner should ensure to follow the security structure or protocol that's in place for such an establishment, and definitely activate the protocol for help. But remember that before you get to the level of seeking extra help from security system, it's important that the healthcare provider try to de-escalate the situation by the way he or she engages with the patient. Because no matter how aggressive an individual is, the bottom line is this, is that they just wish to be heard. And developing the skills to help create a more trusting environment definitely helps us achieve this as healthcare practitioners. More information that highlights other diverse patient characteristics and attributes, and most important, engagement and appropriate styles are explored in my recently republished book, titled Tips for Effective Communication, a Vital Tool for Trust Development in Healthcare. And some of these attributes are such as when patients are dependent or opinionated, overwhelmed, when patients are impatient or suspicious. Utilizing strategic engagement to promote tranquility is important, because when communication breaks down, the environment actually becomes unconducive for better delivery of quality health care. And in the book that I have, there are two parts to the book. In the first part, I discussed the steps that practitioners can also take to reduce the chances of making patients feel intimidated when they're in front of patients. I also talked specifically in that part to patients to make sure that they are doing what they need to do to make sure that the experience in front of the practitioner is not an intimidating experience. And these are listed in the common do's and don'ts that I have listed in the first part of the book. I actually have a new guidebook that was just released that just targeted specifically to patients to give these instructions on the common do's and don'ts to help patients achieve a rewarding clinical visit with their healthcare practitioners. And the second part of the book, I focused more on the details in a system mock scenarios between healthcare practitioners and patients. And I identified the most appropriate times to implement various communication styles, of course, to improve the chances of trust between the healthcare practitioner and the patient. And some of these styles include, I identified the most appropriate times to speak softly to create a tranquil environment. When to temporarily avoid eye contact to give another individual the chance to gather their train of thoughts. When to speak authoritatively while maintaining eye contact to command attention. When to nod in affirmation as another individual is speaking to help convey validation. Even when to use humor to help reduce perceived tension in an environmental setting. How to engage effectively also with adolescents are listed in this part of the book. How to effectively engage with patients who are also healthcare providers themselves. How to engage effectively with parents whom I fondly refer to as Dr. Mom and Dr. Dad. And these are overly enthusiastic parents with underlying anxieties about their children's healthcare and consultation visits. And by the way, I am a Dr. Mom myself. I have 4 daughters, and with 4 daughters, I actually have one of them has asthma diagnosis. So I can totally relate to parents' fears during an acute child's illness presentation. But know that there are strategic ways of successfully engaging with enthusiastic parents to help promote a trusting environment. The website again is www.nonyetochi.com, and these books are available on Amazon and also on Barnes & Noble. Please don't forget to subscribe to my weekly newsletter when you're on my website. The books are also available on my website. Also subscribe to my official YouTube channel. You can follow me on Facebook and Instagram at the handle @TheFamilyNurse. Some of the presentation references that I consulted to help put this presentation together. I want to thank you all so much. Once again, thank you very much for the opportunity to present this important information to you. And I hope that you take the time to listen to it and take the time also to pick up my books and look at all the different characteristics that are out there and how to make sure that we as healthcare providers are utilizing the skills that we all can develop once we pay attention to it, to these characteristics to not only help reduce the patient's anxieties and over patients who are just fearful about what's going on with their health presentation, but also to help us as healthcare providers build that trusting environment to help create a more chronic, a more a view that when we continue to see patients in the future, that these patients will trust what we tell them to do and actually do it to help manage their care. thank you so much again for joining me, and take care, and God bless.
Are you trying to stop sharing your screen?
I'm trying to stop the recording. So I stopped the share, but I think I have to stop the recording somehow, right?
Yeah.
Is it stop video?
Yeah, you're still sharing your screen.
Okay, so